Hi YouTube family, Redhead Metal Diva here, reducing red, bringing you my week 34 post-op VSG surgery update. Quick numbers: highest weight 238.4, day of surgery 229.0. Last week I was 150.0. This week I'm 151.2. There is a good reason. I'm actually surprised I didn't gain more. I went up to out of town to visit my best friend, and we ate out a lot. I had some Taco Bell, I had some Del Taco, a lot of calories from drinks, and obviously didn't do anything physical. So good reason, but now I'm back home. I can eat what I want to eat, have fresh stuff. You know, staying in a hotel, you're a little limited on what you can prepare and what you can eat. I could have made better choices, you know, of where I ate, I guess, except my best friend probably wouldn't eat where I would want to eat. So it's fine. It's the first time I visited him in months, so yeah. So speaking of that, I was in Phoenix for the weekend. Had a going away party for my boobs since I'm having my breast reduction tomorrow morning. So in 24 hours I will be in surgery, hopefully nearing the end of surgery, so that'll be really exciting. I'm ready. I have everything that I need. I've been taking my bromelain and turmeric and arnica, so I feel good. I feel really good. So that's surgery tomorrow. I have to be at the hospital at 5:30 a.m. I'm the first case of the day, which is good. And I'm hoping, you know, that the anesthesiologist can do something besides gas anesthesia, and then that way I won't be so sick for so long. But looking forward to it. It's gonna be good. It's gonna be really good. Along those lines, I had to stop taking any aspirin or NSAID medications, so I've been on Tylenol, which doesn't really work. And I've known it doesn't work, but you know, it just takes enough of the edge off that I feel like I can still survive, but everything else has started hurting. I have an old shoulder injury from a car accident, you know, that has always given me problems, but hasn't been hurting too bad since the surgery, as long as I don't misuse it. And I'm not quite sure if I did something to misuse it or to, you know, start it back up, but it's been hurting an awful lot. And then the tendonitis in my right elbow was unbearable yesterday. I couldn't straighten it all the way, and I couldn't bend it, you know, 90 degrees or more because it hurt so much. And then my ankles are sore. Obviously my neck is very sore. So I think it's just, you know, the NSAIDs, you know, I kind of had a constant level in my body because of the migraines for so long that it, I think, was taking care of other problems. And so now these are all coming back to light, and pretty worn out. But obviously during the surgery and anesthesia, I'll be out of pain for some time, just because of the anesthesia and whatever pain meds they'll have me on in recovery. So hopefully I'll be able to go back to Excedrin and Advil pretty soon after the surgery. I know I'll have to hold off for a while just to, you know, not increase my bleeding risk after surgery, but maybe my incisions will hurt so bad that I won't realize other stuff. Probably wishful thinking, but I will wishfully think away. So I'm sure you guys have noticed, you know, I have pretty fantastic skin. I changed how I took care of my skin almost 2 years ago, and since that change, I really don't get breakouts. I don't have blemishes. So all of a sudden, like Thursday, I think starting Thursday, I had like a couple blemishes, and like on my shoulders and my chest. Not a huge deal because it's not terrible. It's just weird that I really didn't change anything. Well, unless taking the supplements or taking Tylenol. I don't know why that would make a difference, but possibly the supplements could be bringing stuff up, I guess. So just weird. And it could also be stress because obviously I've got all this stuff I'm getting done and taking time to go out of town and surgery coming up. And last week was a really busy week with work. Well, the last week and a half that I worked at a different place. It was super, super busy, and I was running all day and on my feet more often than I am at my normal job. Just a lot more physicality related stresses. So it's completely possible that's what's going on. So I'm not terribly worried about it. It's just kind of peculiar. And of course it happens right before I'm, having surgery, and they're going to be looking at all this stuff. And I'm sure not that they care, but just interesting. What else? This is the first time my best friend's seen me since losing a lot of the weight. He saw me after I lost maybe 30 pounds or so. And this was the first time he's seen me, with a 90-pound weight loss. It's weird because I still don't feel that different. I know it's very, very different, but I have to remember and think about it after I get surprised about something, and then it makes sense. So, still a disconnect. I don't know if it'll ever really go away, but, so I guess a short video today. I'm going to try to get a little nap before a doctor's appointment, and then I'm having dinner with my mom and my husband, and then I'm going to dye my hair, since I probably won't be able to reach up to dye my hair for many weeks, so I'll do it right before surgery, and I won't have to look at it or be annoyed or try to do it before I go back to work. But that's about it. Really excited. I am just ecstatic to start taking care of my migraine issues. This is kind of one of the first steps, and then obviously physical therapy and the steroid injections I still haven't been able to get. My doctor's office is disorganized or too busy, understaffed, I don't know what, but I really feel like waiting as long as I have since getting the MRI is a little excessive, but we'll see. So thanks for watching, and it's late because I was in Phoenix. Sorry, I should have probably started with that, but I probably could have done it because there was Wi-Fi and I had my iPad, but I've never actually uploaded to YouTube on my iPad. I always, transfer the file to my computer and then upload from there. I don't know if it really makes a difference, but that's just how I always do it, so I just didn't want to try a different way. But yeah, I got my nails done. I haven't had my fingernails painted in like 4 years because working at hospitals and surgery centers, you can't have nail polish. So I was like, you know what, I'm not going to be at work for like 2.5 weeks. I'm going to do it. So I got the gel manicure, so it's the stuff that doesn't chip and doesn't fade and stuff like that. Because that's my other issue is once there's like one tiny chip, I take it all off. It just bugs the crap out of me. So I'm kind of excited. It's fun. Yay, red nails. I feel so girly. You know, like everything I do, I go to reach somewhere and I'm like, oh, I see my nails. So I feel like I've been extra dainty with my hands just because I can see my fingernails. Anyway, so far so good. Gel manicure holding up. I recommend it. If I'm able to get away with it, I will probably do it again because I hate seeing all the like dust and stuff that gets under your fingernail and you can like see it, you know, when you have naked nails. Oh, I hate it. So I'm always scraping underneath my nails. So this is a nice treat because I get to be relaxed and not worry about my nails. So yeah, thumbs up. Nice, pretty red thumb up. Thanks for watching, guys. I will see you on Sunday. And it'll be my first video after my breast reduction, so it's very exciting. Alright guys, see you later. Thanks.